As the seasons change in the Northern Hemisphere and we begin to move into the colder months, I'd like to make a public service announcement about vitamin D. This announcement is for anyone listening, but first we'll look at its connection to preconception and fertility. From a preconception perspective, studies have shown that vitamin D plays a role in fecundity, fertility, and has been linked to positive IVF treatment outcomes. This may be because vitamin D also impacts reproductive health. Vitamin D receptors can be found throughout the male and female reproductive systems, including the ovaries and endometrium, as well as the testes and sperm cells. There are studies that suggest that vitamin D is vital in helping to regulate the menstrual cycle. Vitamin D has also been shown to support women and people diagnosed with PCOS by decreasing insulin resistance. For anyone else listening who is not on a preconception journey, vitamin D plays a significant role in cardiovascular health, immune function, bone health, blood sugar regulation, metabolism, mood regulation, along with a host of other physiological processes. It suggested that vitamin D levels be checked in late winter and early spring. However, in my personal opinion, especially for Black and Brown people, I think there's some wisdom in checking levels also as we approach fall and winter. Knowing our levels provides us with the opportunity to fortify our bodies in preparation for the colder months, especially for those folks who are at risk for vitamin D deficiency. And these would be people who have darker skin, people who have higher BMIs, body mass index, older people, people living in colder climates, people who work remotely, people who wear clothing that covers most of their skin, as well as some others. And vitamin D deficiency is quite common. One, because our greatest source of vitamin D is sunlight, to which people may be exposed at varying degrees. There are also minimal food sources rich in vitamin D, so supplementation is necessary when treating deficiency. For bone health, you want vitamin D levels to be above 30 nanograms per milliliter. But vitamin D is a fat soluble vitamin, so it is possible to reach toxic levels. And this is why, as it pertains to supplementation, it is best to consult your medical provider about the dosage. It's also important to note that not all medical providers check vitamin D routinely, so you might have to ask them to. And if for whatever reason you don't have a medical provider, there are also freestanding labs that you can visit to have your levels checked. But no matter who you are, vitamin D is crucial to your well being. But if you are someone who has been suffering from reproductive health issues or you are on a fertility journey, it might be useful to have your levels checked.